In this lecture, we're going to talk about resolution as it applies to sonographic imaging. Resolution is the overall image accuracy and quality. It is the ability of the ultrasound machine to accurately demonstrate structures in their correct size, shape, and location. Resolution has many different components, and throughout this lecture, we're going to get into each one of them, but they are axial resolution, lateral resolution, contrast resolution, temporal or time resolution, and spatial resolution. Axial resolution is specifically the ability to display two closely located structures along the beam's main axis as two separate structures. There are multiple different synonyms for axial resolution, and you will want to know this acronym, LARD. So it's longitudinal, axial, range and radial, and depth. All of these refer to the same thing and most commonly known as axial resolution. Axial resolution is the machine's ability to resolve structures that are located parallel to the beam's axis. So if you see here, we have the ultrasound probe that's sending out sound waves, and these are along the same axis or parallel to the beam's axis. So axial resolution has to do with being able to delineate structures that are seen in the same direction that the beam is going. So you can see here in this example, there are 4 different structures along the beam's axis. And in the ultrasound image, we are able to differentiate between these 2 structures, but these 2 close structures are being demonstrated as one structure on the ultrasound machine. So with axial resolution, these 2 structures are being resolved. These 2 structures are not being resolved and are combined as one structure. Lateral resolution is then the ability to display 2 closely related structures that lie perpendicular to the sound beam. And there are a lot of synonyms as well for lateral resolution, and the acronym that you can use is LADA. So this is lateral resolution, angular resolution, transverse resolution, or azimuthal resolution. All of these are used interchangeably and tie back to lateral resolution. Here's an example of lateral resolution. When a beam is at its narrowest, that's where it's best able to resolve different structures. So you can see here when we have 2 different structures and the beam is very narrow, it would be able to separate those 2 different reflectors as 2 different structures. When we have the larger or wider beam and there's 2 structures, it may be seen as one reflector as opposed to 2. But you can see that these are perpendicular reflectors to the sound beam. Just a quick example of showing the difference between axial and lateral resolution. Again, axial resolution is going to be parallel to the sound beam, whereas lateral resolution is going to be perpendicular to the sound beam. Contrast resolution then is the ability to distinguish a variety of intensities or shades of gray within an ultrasound image. Here's a pictorial example of contrast resolution. So you can see the image on the left has a wider range of shades of gray within the image. So you have good or low contrast resolution, where the image on the right has more black and white. The blacks are very black, the whites are very white. There's not that contrast of shades of gray within the image. So that would be poor or high contrast resolution seen in the image on the right. Temporal resolution then is the ability to accurately locate moving structures at any particular instance in time. For example, the opening and closing of a heart valve, or the kick of a baby, or blood flow moving within a vessel. And temporal resolution is determined only by frame rate. More images per second improves temporal resolution. So if you have a higher temporal resolution, you'll be able to easily pick up on this movement. Temporal resolution is affected by numerous different things. So one of them is image depth. If we are trying to image something deeper, then it's going to take the machine more time and effort to create that image. If we're asking the machine to use multiple focal zones and zone in on different areas that we want to image crisper or clearer, then that's going to take more effort and time on the machine. Same with line density. If we're asking for additional lines on our image, then it's going to take more time. Sector width, we can increase and decrease the width of our image and how much information we want to show. If we have an increased sector width, it's going to take the machine additional time to create that image. So the easiest way to remember temporal resolution and what it's affected by, if we are asking the machine to do more work, it's going to create more time and additional time that it takes for the machine to complete that task. To determine the effect on temporal resolution, you could ask some of these questions. Is the image shallower? Is the image comprised of fewer pulses? Shallow imaging and imaging with fewer pulses have an increased frame rate and better temporal resolution. We are asking the machine to do less work, so therefore our temporal resolution will increase. Deeper imaging depth results in more time required to make each image and fewer frames that can be created each second. So therefore, if you have an increased imaging depth and you're trying to image deeper, your frame rate is going to decrease, therefore decreasing your temporal resolution as well. And oftentimes this is visually noticed when you're scanning. If you have multiple different things on, such as color and Doppler, and your depth is deep, you're going to visually notice the slowness of the image creation on your machine. So here are some ultrasound images showing the relationship between image depth and frame rate. So here on the image on the left, you can see that our image depth is at 15 centimeters and our frame rate is at 28. On the image on the right, we are imaging deeper. We're getting 30 centimeters of depth, which drops our frame rate to 16. So it has a direct correlation and a direct effect on the frame rate and ultimately the temporal resolution of our image. The use of multiple focal zones can also affect temporal resolution. So with multiple focal zones, we're asking the machine to create more sound pulses per line, which decreases the frame rate and ultimately decreases our temporal resolution. However, there's a trade-off with that. Multiple focal zones also generally improve lateral resolution. So it's a trade-off. Do you want higher temporal resolution or higher lateral resolution? It may depend on what you're scanning. Just so you're aware of what multiple focal zones would look like versus a single, focal zones are always depicted along the right side of the screen with the depth, and it corresponds to where you're imaging. So here you can see there's just one focal zone, and on this image there are multiple focal zones, which would drastically decrease the frame rate and the temporal resolution. Increased line density or asking for more lines, of course, will give greater image detail and less space between image lines, but it also requires more sound pulses per image and will decrease your frame rate and your temporal resolution as well. So again, there's always a trade-off. With sector size, a smaller sector angle uses fewer pulses. So if you can do that to improve your image, you would always want to decrease your sector size, but you never want to clip anatomy or have it too tight where you're not seeing everything that you need to see. But with decreased sector size comes a higher frame rate and better temporal resolution. Here's a great example of sector size and the difference between the frame rate. So on the image on the left, we have a very large sector angle. We're imaging a lot of anatomy, but with that, our frame rate is 24. Over here, we decrease our sector size and it's much smaller. Of course, it's not appropriate for this image because we're clipping some anatomy, but just as a demonstration, decreasing that sector size then takes the frame rate up to 42. So it drastically increases our frame rate and our temporal resolution. Frame rate equals the number of images created per second. There is no frame rate button that you will find on our ultrasound machine, so the sonographer cannot go in and simply adjust frame rate. However, all of the things that we've talked about with sector width and depth and things like that have a direct correlation on the frame rate. So a higher frame rate results in greater accuracy in locating moving structures, decreased line density, and less time to create each image. And lastly, spatial resolution is the ability to visualize detail in an image, and it's also called detail resolution. So this is an example of spatial resolution. You can see in this image here, it has great detail, great spatial resolution, and as we move through these images, it becomes harder and harder to tell who this person is. If I was to present you with this image first, you probably wouldn't know. Maybe by here or here, you could take an educated guess, but by the time we get to this image, we have great spatial and detail resolution of that image, and we can then recognize that that is former President Bill Clinton. So just some tidbits to wrap up. You always want to select your settings according to your individual patient. Each exam, everyone is going to be different. So there's no right answer for selecting your imaging depth, your sector size, and number of focal zones. It's really going to depend on your patient and what you're imaging. Remember that the equipment establishes the frame rate and line density. There is no button that as a sonographer, we can change those two settings. However, we can make changes that cause the machine to alter the frame rate. So keep in mind things that you can do to alter the frame rate and improve your image.